Welcome to the Body Shop Physical Therapy. My name is Catherine Price and I'm a physical therapist. Due to my own experience this week with BPPV, benign paroxysmal positional vertigo, I'm going to share with you what I went through and what are some exercises that I can do to alleviate symptoms and manage this. Now, you do want to have the appropriate diagnosis. Vertigo can be dangerous and very uncomfortable, and you do want to be correctly diagnosed. This is not meant to provide a diagnosis or treat anything. This is pure informational. Before I begin, I'm going to speak a word of life from Psalms 119:105. Thy word is a lamp unto my feet and a light unto my path. So what happened with me this weekend, I was lying down and I turned my head to the left and my world just started spinning. I felt like I had the experience of a roller coaster ride and everything was moving. It's never happened to me before. And I realized it was the world spinning with head position. So when you have your head put in different positions, if the crystals, they're called calcium carbonate crystals that are in the inner ear, and if they get into one of the canals, you can totally lose your sense of where you are. So there are three things that contribute to balance. One is our vision. Two is our inner ear, so that is that vestibule. It's like a big bowl with three rings attached to it. And then our proprioception, our nerve endings that tell us where we are in space. So vestibular system can really upset the balance and equilibrium of a person. And vertigo is when your world is starting to spin. And there can be peripheral or central. Now, if it's mechanical, that is when the world is spinning from the crystals getting disrupted in the ear. And there's three canals, anterior, middle, and posterior. And the majority of problems are in the posterior canal. So when I leaned back and I turned my head to the left, my world started spinning. So I was able to lie on my right side and stay still and just do absolutely nothing, and things could stay somewhat managed. Of course, it gets me feeling nauseated when my world spin. I'm not one of those that deals with motion sickness very well. So I thought, well, I'm dealing with a left posterior canal problem. So I decided, well, I'm going to go ahead and go through the maneuver to get those crystals back where they belong so that I can get on with feeling better. Some people spend days having this feeling of unequilibrium in their world spinning, and it can be dangerous. You can lose your balance and fall, and it is something that does need to be addressed, and it's actually a pretty easy thing to treat. You just want to know what you're treating and what to do. So again, you really need your healthcare provider or physical therapist to evaluate and assess you to make sure you know what you're dealing with. And once you do, then you're good to go, and you want to follow the advice of your healthcare provider. So I did have someone around. I asked my husband to stand by and went through the canalith repositioning to get those crystals back where they belong. So when I did this, I did grab a bucket because with my patients, sometimes you end up being nauseated, and I do not do well with the motion sickness, and I knew I was going to feel sick, but sometimes we have to feel sick to get better. So I had my bucket close by, and if it's my left posterior canal, this is what I went through, and it's the exact opposite if it would be my right side. So if you are lying down and you turn your head to the right and your world starts to spin, it's most likely right posterior canal. If I lie back and I turn to the left and my world spins, it's my left posterior canal. So what I went through was a canalith repositioning. To do that, I got on my bed, I sat upright, I turned my head 45 degrees to the left, and then I'm going to go back quickly and keep my head extended. Now, just turning my head to the left was making me dizzy, or the world was spinning around, so it was already uncomfortable. It takes about 30 seconds for the crystals to settle down for that to go away. So you want to hold each position for 30 seconds. So I turned my head 45 degrees to the left, and then I went down quickly, so I came back off the table with my head extended, and I just stayed here. And you want to wait until everything settles down. It usually takes about 30 seconds. After everything is settled down, I'm quickly going to rotate my head to the other side, but keeping the head extended. So on the count of 3, I rotate to the right. 1, 2, 3, rotating to the right. So I'm just taking those crystals and I'm taking them through the canal and then dumping them back in what you call the utricle. It's this part of the vestibule. And I just wait here. And then I turn my body, but I keep my head still. And when I do that, my nose is going to be angled at a 45-degree angle down towards the floor. And I just stay here until the dizziness subsides or the world stops spinning for a little bit. And then I'm going to come up quickly and look towards the wall in front of me and just hold right here. And it is a good idea to have somebody with you to help you feel stable. You don't want to lose your sense of space and get off balance there. Now, after I did this, I did end up vomiting, so it can make you really sick. And after that, I did stay upright and I did stay still for a while and did take an over-the-counter medication for motion sickness as I had become very nauseated just from the sense of having that loss of equilibrium. So the next day I was 100% better and I haven't had any problems since. So if you can address this early on and get the crystals back where they belong, you can get to feeling better much faster or as soon as possible. Now, there is something called Brandt-Daroff exercises, and so with my patients, after we know what's going on, we treat the problem, then we do exercises to prevent it from coming back and to keep the BPPV at bay. So the Brandt-Daroff exercises, what you'll do is you're just going to sit on your couch or the edge of your bed, and you turn your head 45 degrees one direction, and then you just lie down and stay in that angle and hold there for 30 seconds. Now, if you're not having the symptoms and everything in the world is staying somewhat still, I'm okay that you don't hang out for the entire 30 seconds, that you can hold it for 5 or 10 seconds and come back up. And then you turn your head 45 degrees to the other direction, and you just come down and hold that position for 30 seconds and or until everything settles down, which usually is 30 seconds. And again, if I'm not having symptoms, I'm okay staying 5 or 10 seconds, come back up, repeat, opposite side, going down, hold, and back up. Turn to the right, 45 degrees, down to the left, and hold, 2, 3, 4, 5, back up, turn to the left, 45, and down, and hold, 2, 3, 4, 5, and I'll do that about 10 or 15 times on both sides, and that is those are the Brandt-Daroff exercises for the rehab for BPPV, which is benign, paroxysmal, positional vertigo, and it can be very uncomfortable. So I hope this is of help and have a blessed day. Thank you.